Welcome to our Google Hangout. I'm so excited because tonight we have a very important topic to discuss. It's about the Infuse bone graft of lawsuit that's happening across the country. And we have a very special guest. His name is Scott Richardson, and he is the executive director for the R.J. Hurwitz law firm. Now, Scott, we really appreciate you taking your time to be here with us. Welcome.
It's great to be here, John, and I'm looking forward to sharing a lot of important information about the danger of infused bone grafts.
Now, Scott, I'm not too familiar with this infuse procedure or what it, why there is a lawsuit. I've read some reports where this certain product by Medtronic actually causes an overgrowth, or it's something that's in the people's spine. I really don't understand it. Could you give some insight on that, please?
John, you just nailed it, okay? The best analogy that I can give is I've been watching this science fiction show on TNT lately, Falling Skies, and they have these parasites that get into people's spines, and then they start causing all kinds of damage and pain. Well, that's the best analogy I can think of what's going on in people's body with this infused bone graft. I mean, this stuff turns out to be dangerous. And the sad thing is that we have a company, Medtronic, which is still pushing this, telling people to use it, and doctors are still putting it in people's spines, for heaven's sake. So the first step is, if someone has had a neck or back surgery, and typically they'll know whether it was a fusion surgery, that's the most common, but really just about any kind of neck and back surgery other than maybe a discectomy or something. But if you've had a neck or back surgery, and after the surgery, let's say it was a low back surgery, you were starting to get better, and then things just started gradually getting worse. And you went to your doctor, and this is the pattern that we see. They went to your doctor, and you said, "Doc, I just don't know. This is like, I don't think everything's right." And the doctor will typically go either ignore you or say, "That's normal, just don't worry about it." And in rare cases, they'll say, "Well, let's get an MRI. And by the way, an MRI is not the best test to show this problem." But they get the MRI back, and they say, "Hey, it looks pretty good. I mean, what are you complaining about?" They're not the ones in pain. Our clients call us up. They are crying. They are in so much pain. I'm not kidding.
I believe it.
And so they're in pain, and the docs are basically either downplaying it, or they're saying, "No, there's nothing wrong. It's all in your imagination." Oh, yeah, right. I mean, if they were in that much pain, they wouldn't be saying that. And the first thing we're going to tell them, and if they just see this video, they can do it. They need to go to their doctor and get their operative report. And their doctor has that. It's usually just a couple pages long. It's not a big deal. And what they need to do is, and if they call us, we'll give them more help on how to get it and stuff. But get the operative report, and then here's something that'll sound to some doctors a little bit different. They need to get the operative report and the chart stickers. So if they get the operative report and the chart stickers, that's best. If you can't get them both, at least get the operative report. That'll get us to first base, and maybe to second base, and maybe to home. So get the operative report and then fax it to us, or mail it to us, or scan it and email it to us, or whatever. And we'll review that. If it mentions infuse in there, bingo, that's first base at least. Then we know that you've got that situation going on in your neck or back or body. So sometimes, however, it's not clear. It won't say infuse. It'll say something else called BMP. That's like boy, Mary, Paul. So BMP stands for, it's a big word, but you don't have to remember it, but I'll just throw it out there. It stands for bone morphogenic protein. But basically this BMP is this bone growth factor, and it can be another name for infuse. So if your operative report says something about BMP, then that's when for sure you need to get the chart stickers. And often the surgeon doesn't have the chart stickers because he doesn't really care about this stuff, okay? So typically if the surgeon doesn't have the chart stickers in your chart, then and try to get them that way, it's fastest. And by the way, he shouldn't charge you anything. He or she, your surgeon, shouldn't charge you anything for your operative report. So, but get this, ask for the chart stickers if you can. And then, but if your surgeon says, hey, I just don't have them, we don't keep those things around, then you're going to need to go to the hospital and ask for your operative report and your chart stickers from there. Hospital always has them. So get your chart stickers, and then they will actually show right on there whether Infuse was used or not. Again, if it shows up on your chart with your chart stickers, then bingo, we know you've got that growing in your body. So that's the first step. Step number one, get your operative report, and if you can, get your operative report with your chart stickers, and let's read it together. That will tell us if you've got Infuse growing in your body. And I will tell you that out of the people that call us, about 1 out of 4, that's what's going on in there. So we find out, okay, you've got Infuse. Now, the next step of the process is that we will help you get all of your medical records. And we need them all, because you'll see in the next step, we have a doctor to review them. So step number 2 is we will help you get all of your medical records. If you already have them, you're ahead of the game, and we'll be able to evaluate your case faster. And there's nothing wrong with requesting all of your medical records now. But let's start with the easy part, just the operative report. And then after we get that, then we'll help you get all of your medical records.
Okay.
After you get all your medical records, then step number 3 is we will have a medical expert review your medical records. And the medical expert will tell both our client and ourselves if this is a strong case to file a claim against the company that made Infuse, which is called Medtronic. And so if it is, we will file that claim. And so that's step number 3. While we're getting your medical records reviewed, there is something you, as a potential client, can do that will help the doctor that's reviewing your case and us determine whether you have a case or not. And what that is you need to ask your doctor, even if you've had an MRI, that really isn't the best exam for this, you need to request, after we got your medical records, while we're waiting and getting it reviewed, you need to ask your doctor if he or she will order a CT scan. It's a computerized X-ray. So ask your doctor if he'll do it. If your doctor says no, quite frankly, I would go to another doctor and get a second opinion and say, I'd really like to get a CT scan to see what's going on in my neck or back, or both. So you can do that while we're reviewing the medical records. And with a CT scan, that is the most helpful thing that we can give to our medical expert to determine whether you have a problem caused by this infused bone graft. Now, I said at the beginning that, you know, this reminds me, or it's like an analogy of that TNT cable TV show called Falling Skies, where the alien parasite gets in people's spines and causes all this pain and damage. Well, that is the best analogy I can think of. But let me explain what's going on actually that causes this. Infuse, this bone morphogenic protein, I mean, it already sounds kind of strange. What it is, it's a bone growth factor. Now, sometimes in layman's terms, I tell it's like a bone cement. It isn't actually a cement. But what it does is it causes the bones to grow together. But the problem is, except for a very narrow usage that was approved by the FDA, the Food and Drug Administration, other than that, The FDA said, no, this is not good. It's not approved to use in the neck area, which they use all the time. It's not approved to use in the lower back area on multiple levels. It's not approved to use in the lower back area if the doctor goes in and does things from behind. It's only approved for just if the doctor goes in through your stomach in front and just does one level. All other uses are unapproved because it's too dangerous. And the danger is that it works too well. The bones grow together, but it doesn't stop. They just keep growing. And that's what I mean. It's like that science fiction show with the parasites getting in people's spine. They just keep growing. And the results can often be tragic. It often grows around the spine, right into the spinal cord. That's the part that carries the pain signals and all your nerve endings. I mean, these people aren't crying. They're in so much pain when they call us. And so, and I will say more often than not, when we refer them to a surgeon to see if surgery can correct the problem, I'd say more often the surgeon goes, that's too dangerous to get in there now. So it's like they're consigned to a lifetime of pain, and there's nothing that we can do medically to help them. And it is the fault of Medtronic, the company that made this. Now, what they did, I mean, there's been a congressional investigation. They issued a 1,500-page report blasting this company, Medtronic, for their behavior. They documented with whistleblowers that they were paying doctors under the table tens of millions of dollars to promote this stuff in unapproved usage. They were paying, they wrote like studies for these doctors to publish where they were the authors saying, hey, you know, this stuff's great stuff. Use it in the neck. Use it all over the place. You know, hey, this stuff is safe. Don't worry about it. And as another doctor who criticized these so-called studies, he said, wait a second. You're paying these doctors millions of dollars to do these studies. And they not only don't tell us they're getting paid this money from Medtronic, but they're coming back with these studies saying it's safe to use, and they're saying there are 0 side effects to stuff. And the doctor that wrote this report in a journal called Spine Journal said, wait a second, there's side effects with aspirin. And you're going to tell us that there's no side effects to Infuse? I mean, he says, come on. You think we're stupid? And apparently, Medtronic did, and doctors didn't realize what was going on for quite a while. But now, at least somebody started blowing the whistle. But Medtronic is still using this stuff. Not as much, thank goodness. Doctors are a little bit more aware, but they're still using it in unapproved usages. And it's still causing problems to this day.
Wow, Scott, thank you. That was extremely informative. I hope that the people, if there's anyone out there that's suffering, that they can get the help that they need, and this little video just helps them. But thank you so much for being available. Your contact information will be at the end of this video. And again, I can't thank you enough. Do you have any closing comments?
We'd like to help as many people as we can, and most people don't even have a clue that this is what's causing their problems until they see our TV commercial or see it on a news announcement. So please call us and let us help you find out if this is what happened to you. And it's that simple.
All right. Well, thank you very much, Scott Richardson, Executive Director for the R.J. Hurwitz Law Foundation, our law firm. And we look forward to our next hangout, which you promised. Remember, you promised to talk about that congressional 1,500-page report in this investigation. Thank you very much, Scott. Have a great night. Thanks.